Hi
Hi,
guys.
guys.
Welcome back.
Welcome.
Yes, Holy Hands in Healthcare. This is Kayla,
This is Taya.
and we are on episode 7
Oh
now,
my gosh.
which is crazy.
Moving right along.
We are. And sorry guys, I have my dinner on my side because I've had a really busy day and I've been up since like 5:45. So I haven't.
Oh my gosh.
I know.
Dang.
I worked out
That's
before
early.
class today, and I will never do that again.
That's
I've been
wild.
exhausted. I
Yeah.
feel like the day was like so long today.
Yeah.
But I'm trying to make it to youth group later, like right after this. I'm leaving, so
Yeah.
just gotta.
That's amazing.
When I chew, I'll make sure to go outside the mic. Okay?
Good full day.
Yes,
Proud
no,
of you.
it was actually a really really good day. It was productive.
Yeah.
Yeah.
It's also a beautiful day today, so hope you guys are enjoying
Mhm.
the
Yeah,
weather.
getting outside, super nice. Our apartment complex has ducks. And Taya saw them on the way over. It was so sad because she goes, oh my gosh. She was like, there's like 3 ducks. And I was like, yeah, you want to know the sad thing? There were 11 5 days ago.
Oh my gosh.
There's
And then I
3.
got emotional.
Yeah, and then Taya was like, no. I was like, yeah, my roommates broke the news to me. I was like, I would have been totally fine without hearing that.
Yeah.
Anyway,
Ugh.
that's my life a little bit. But they're the cutest little things. They're so cute.
Yeah, they're adorable.
Yeah.
We're starting something fun today.
Yes.
Kind of going a little more like niche, talking like specifically about certain nursing school terms, and so the next few episodes will kind of be that, just us talking about some of more specifics about the terms of nursing school. So if you're going through that one, you can listen to the episode, and hopefully it'll just give some insight, some perspective, just our perspective. So
and like
maybe
it might help specifically with West Coast or any accelerated nursing program, because those are relatively the same. If you are doing a 4-year, like our friend Lainey, who came on last episode, those ones are a little bit more, they're separated a little bit differently. So you take different terms with different, I guess the terms are taken a little bit differently. So you might be paired with like med surge and, gosh, I think some of them do like OB and peds together.
Yeah, that's crazy.
Which beyond
crazy.
So it just depends, but either way, we'll still give you like the rundown on
the specific class, more
things that helped us study wise, and
so today we're going to talk about fundamentals, mental health, and PA. We didn't take those all at the same time, but we're kind of meshing them together.
They were all relatively in the beginning. With med surge kind of breaking it up.
Right. So let's start with fundamentals.
Yeah.
Very first term of nursing school.
That's crazy.
Yeah. Yeah.
Crazy.
We're little babies.
Little babies. And it's crazy because now we think of like vital signs. We got validated the first day.
Oh my gosh, I was so nervous.
And we were like crapping our pants. We were so nervous. And now those are the types of things that we do as nurses that like, or as student nurses that we like don't want to do over again on the floor because we're so sick of them. We're like, I have to take those again. You know?
Right. And it becomes second nature.
Exactly.
Yeah.
When it becomes second nature, and everything's scary the first time.
Right.
But you will, especially like sugar checks.
Gosh, we
do those so much. I have like Lancets all over my room.
Yeah.
I accidentally take them home.
Doing blood glucose checks now, it's like so easy. Like if my nurse asked me to do a blood glucose check, I'm like, oh yeah, it's like the one thing I don't feel nervous about. But back in funds, that was like so nerve-wracking. When I was thinking back about funds, a lot of it is so kind of awkward at first. You know, you're not used to talking to a mannequin to get validated, or even just talking to a patient, or sometimes like your friend is the patient when you're getting validated, and it's kind of awkward. And so
totally
just kind of like embrace the awkwardness and kind of fake it till you make it in that sense. When you're like getting validated, like just literally have a conversation with the mannequin. Like,
yes.
And I feel like now I'm like, I go into a simulation, I'm like talking with the mannequin so much, like, but it is kind of weird and uncomfortable at first, and kind of just like push past the awkwardness.
Yes, absolutely.
And just kind of have fun with it, I guess.
Oh, I definitely have fun with it.
Just fake confidence, I guess. In that sense, I know I say be humble a lot, but in that sense, I'm like kind
fake it till you make it.
In that sense, fake it till you make it.
Oh my gosh, I remember those days.
Yeah.
I agree with that for skills, specifically fundamental class. For funds, I would recommend, and it's really hard in an accelerated program. I still struggle with this, but going over the material before they teach it in class is seriously so helpful. We can usually do it the first week. I find myself doing it the first week, and then because we have that week break kind of in between our terms to kind of go over what we're going to learn, and the teachers post it beforehand. But then sorry, my phone's going. Sorry. But as the kind of weeks go by, you're overwhelmed with everything. My
Yeah.
gosh.
Chuck it, chuck it.
um that was
I don't
funny.
know why I said
But
that.
anyway, gosh, we're so energetic right now. But my recommendation is to just definitely go over those kind of topics beforehand.
Yeah, even if it's
It
just
makes it so
really
much easier.
quick, just so you,
Yes.
oh, I kind of know what this is about, or
I
like
didn't do it
have
this
an
week.
idea.
I was so lost.
Yeah.
And we've like gone over all of endocrine before,
Mhm.
and we're in our last term and we're doing it again. So by the way, everything gets repeated every term.
Yeah.
So you
Yeah.
really want to get a good foundation in funds
Yeah.
and in your farm, which we'll go over because that'll never leave you. But
Yeah.
you really just got to make sure you have a really good fundamentals of patho. So most likely you do have to take, I think that's a requirement. You have to do patho before funds.
Mhm.
Pay attention in that class. Do not just try to get by. I tried to
Yeah.
get by and it's
Right.
biting me in the butt
Then you have to
because
relearn
now
it every
I
single
had to relearn all my
Yeah.
patho and it's so hard and the ones that I really did um like stick to memorize, I feel so much better about the patho, but
Mhm.
gosh, I that's one thing I really would do in my past self is change that.
Yeah. Yeah. I mean, fundamentals, I mean, really is the name. It's fundamentals. It's your foundation as a
Mm-hmm.
nurse, like your nursing interventions. And, you're not learning a lot of disease processes in funds. You're learning more
Right.
like how high do I want the bed to be raised for the patient? When do I want to put a nasal
Right.
cannula on them versus a simple face mask? And like, that's such a great example. It's like your different oxygen delivery. Like I remember then the next time going to med surge one at our sim, our professor was like, okay, who knows like the different like liter amounts for each oxygen delivery? And I was like, I remember learning this in funds, but I do not remember at all. And so even
Right.
now we're in critical care. I just did a simulation. It's like you need to know how much you can give 1 to 6 liters on a nasal
Mm-hmm.
cannula. You're not going to give 15 on a nasal cannula.
Right.
So it's like it will come and show up. And don't worry, like if you don't remember, they will go over it again. But just know
Yeah.
it can seem so simple right now. And it is kind of like common sense once you learn it, but it really is your foundation as a nurse,
It
these
is.
little things. And be like faithful in the little because it'll make you a better
Yeah.
nurse when you're like learning about these
It
disease
absolutely
processes.
makes you a better nurse. And to
Hmm.
go along with being a better nurse, I think as new nursing students, we don't realize that interventions that are there to help patients can also
Mm,
um like hurt them
right.
too.
That's
Like
such a good point.
oxygen is great for patients, right? But if we have too much of it, that can also be just as
Hmm.
detrimental to their health
Hmm.
as them having no oxygen.
Right.
So
Yeah.
just knowing that when you're starting off, like they're going to teach you all that, but you just that's why it's so important to know the different levels of oxygen, who you're going to give it to, and
Hmm.
like if they can handle that. So that's just one thing I will say about that. I was gonna say one other thing, but it'll come to
Mm,
me.
yeah.
But
It definitely like yeah. It's just the basics. It's your
hmm
foundation. So
oh,
yeah.
sorry.
No, go for it.
Um, Taya is a good example, and I because we're different with this, and she can give you kind of a little background on how she thought it helped her or how it didn't. But when I started nursing school, I had previous background of like CNA work, and
Hmm.
then as I went into funds, it was kind of a I guess like re it was a introduction of I just stuttered so
No
it
way.
was an introduction of kind of everything that I've ever learned in as to be a CNA all over again. But it was really helpful to have that. So I would recommend if you haven't already started nursing school, definitely do that. But coming from Taya, she's also an amazing student nurse and she does great and she's really great at talking to patients. Sometimes that just comes to people
Thank you.
naturally. But that's like one of the hardest things. I think people get so intimidated to talk to patients.
Right.
Usually you're in a skilled nursing home, so you're most likely with patients who have like mental cognition impairments or things like that. So it's actually kind of easier to talk to them.
Mm.
It's very fun.
Yeah, yeah.
But
And you're
it's a
like, if I
lot of
say something
redirection.
stupid, they won't remember. So that's what I always told myself because I'm a big overthinker.
It's true though. And
Yeah.
exactly, and just kind of telling yourself that, and it's a lot of redirection, learning to deal with patients in that um, headspace is really challenging at
Mhm.
first
Yeah.
and learning how to redirect them when they get really upset very quickly
Hmm.
um, and kind of learning the right things to say
Yeah. Yeah.
so anyway, yeah, that's a little introduction to fundamentals.
Yeah.
So definitely have your patho good, have your physiology set.
Mhm.
Make sure you have a good foundation in that, and fundamentals will kind of fly by.
Yeah, and just like use it as a term, kind of this is your first term in actual like nursing program, so use it to like figure out how you're going to study, what works for you.
Mm-hmm.
It's like totally new questions, so it's kind of like experimental too. Like
Right.
what's going to work for me? What do I like? How do I like to take notes? How do I like to study? Um that's also it's a good
Totally.
term to just like get kind of like figure that out
And
too.
it's okay
Yeah.
to feel extremely overwhelmed in funds because if you've never had a previous
Oh,
background of
totally. Yeah.
medical light at all, this is going to be a whole new world for you.
It is. Yeah.
And it's going to be really stressful. I think
Mhm.
Taya can attest to that. But kind
Yeah.
of just jumping in and being like, I actually don't know anything. And then you have the people next to you. They're like, I've been a EMT for 10
Mhm.
years, and so
Yeah.
it might come a little easier to them, which
Right.
is fine.
Totally. And, there's pros and cons to both. So just bring what you have to the table.
Mm-hmm.
And if you, gosh, I was losing my train of thought.
Okay.
If you have like more worries or fears, we also have an episode about your first in nursing school. So if you want to hear more about that, I would just go to that episode because I know we're kind of moving quick. So
Yeah, that one's good.
definitely
Sorry,
listen to
yeah, we
that
are
too.
talking fast because we have so much to say in this one, but if we
Yeah.
need to make a part 2, we will.
All right. I think we should jump into mental health. Kind of a whole
Yes.
different world. Switching gears with this term.
Yeah, mental health
Uh,
is challenging.
yeah, it teaches you just communication, interacting with patients.
Hmm.
Yeah, you had a really good perspective on it. Like,
Yeah, I
if you
think
want to share that?
you were at a hospital, right?
Yeah.
And I was at a homeless shelter, and there was some preconceived thoughts of me when I went
Mhm.
in. I was obviously thinking of these people, and I didn't want to, but sometimes you have these judgments that you can't kind of shake off sometimes. But it's important as a nurse to treat everyone very equally and respectfully, no matter what they came in for, because at the end of the day they all came in to get help, and that's what we're there to do for
Mhm.
them. So that was really challenging, knowing that there were some like convicted felonies, and there were some people that have done not so nice things to people.
Yeah.
And so it was really hard to give care to them and help them when they weren't help trying to help themselves, and also
Mhm.
like helping other people. Like they weren't kind to other people. So it was really
Right.
hard for me to, like, I still of course gave that care
Mhm.
in the same way I would take care of any other patient. But it was definitely hard at first.
Yeah. Yeah, that is a challenge because as a nurse, we have to give equal care to everyone, no
Hmm.
matter their background. So, yeah, that's a challenge for
Yeah,
sure.
it was definitely challenging. Did you experience it that much in the hospital, or was it?
I think what I experienced at the hospital, I think, you can kind of go into mental health like, okay, I'm not going to do a lot of skills. I don't want to be a psychiatric nurse. And I would just say,
Mm-hmm.
don't go into it with that mindset. I mean, it's okay if you don't want to be a psychiatric nurse, but I think this term can really teach you a lot. Take
Mm-hmm.
initiative to really communicate with patients. I know because there's definitely a lot of times where it was like we could just be standing around, but I know I had a lot of good experiences where I would sit down with a patient and just talk to them for a
Yeah,
couple minutes, and you would just completely see just
past
their
the
attitude
addiction and
change.
past
Yeah,
the
and
substance
just how
abuse. Yeah.
much they just want to be listened to. And um so I just would really take advantage of that. You're not super stressed, like just sit down with the patient and have a conversation with them. And I know some of our instructors during mental health, they told us, see the person behind the mental illness. Like
Mm-hmm.
there's a person behind that. They have a whole story, a whole family. And just like with any patient in the hospital, you always have to see the person behind the disease. So I think it can challenge you in so many ways. It's such a good term for growth.
Yeah.
And there's one other thing that
Well, I was
I was
gonna,
gonna think about.
if you
Yeah,
think of it,
I will.
let me know. I've thought of something that I know that
Mhm.
you can definitely relate to too. But oh, sorry. Let's do it.
I know we're
You remember
always
yours?
yeah.
Okay, cool.
I think also no matter where you are in the hospital, you're gonna come across people with mental illness.
That's what I was gonna
Yes,
say.
so
Yep,
take
good
like
job.
you need to like if they need serious physical
Mm-hmm.
medical help, they're not gonna be on a psychiatric floor.
Right.
They're gonna need to go to a different unit to receive that help.
Mm-hmm. But
Um
it's kind of like, we'll get into OB another episode, but like people that are like, I don't want to do OB. Well, if you're working the ED,
yeah,
you might get someone that's pregnant,
right,
and you need to know
exactly.
what to do.
Mhm.
Like figuring out the gestational age, and
Right.
are they at the correct developmental age as a mother?
Mhm.
Not developmental age, but developmentally being pregnant wise, at the age where they are at in their pregnancy. Is that normal for them? So kind of same thing with psychiatric nursing. You know, you have someone. Well, I had my interview today at
Mhm.
MLK, and it was a large population of psychiatric patients when we did walked around kind of the ED, and I was like, oh my gosh, I had this preconceived thought of I will never do psychiatric nursing, and
Mm.
that is the most of the population at the
Yeah.
hospital.
Right. Yeah.
And so why I say that is just because even though you might not enjoy that specific rotation, you will get people, especially if you work in the ER, from all different
Mhm.
backgrounds, and
Yeah.
especially dealing with like substance abuse
Mhm.
or mental health disorders. So it's important to, you know, when you're in those clinicals, take advantage of those and learn how to talk to them, because that's the biggest thing, is communicating
Yeah.
with someone that's having um, a whole psychosis episode.
Mhm.
That takes a lot of skill.
Yeah. Yeah. I mean everything Kayla said, you're going to come across it whether you want to be a psych nurse or not. And
Mm-hmm.
as nurses, we do so much caring, we do so much listening, so much communicating. So, um if you don't feel strong in that area, definitely work on it in this term.
Mm-hmm.
And
Yeah,
I would just take advantage. Yeah.
yeah.
It's a really good term to grow.
It is. It's a little uncomfortable.
Right. Yes. It can be
It's
a little
it,
uncomfortable for sure. Yeah.
but the uncomfortable parts of your life, they make you grow. So
Mm-hmm.
you'll learn something from it. I promise you'll learn something.
Yeah.
At least one
Absolutely.
thing.
Yeah. Yeah.
But studying wise, I'm trying to remember kind of what
Mm-hmm.
helped us. Um,
A lot of therapeutic communication
yes,
questions. And like, obviously, in real life, you're not going to sound like a robot how these responses sound on your
right.
tests. But just for the
They
sake of
told
the
us like
test,
just pick
yeah.
the answer that's the most cringiest. That's
Yeah.
what they would
Oh,
tell us. Like
yes.
the cringiest answer is the right one. I
Yes.
was like, yeah, that makes
So
sense.
just like know how they want you to
Like,
therapeutically communicate
like
and for your
yes,
test.
like when the patient's like, I'm feeling a little, sad or anxious, and then the answer goes, what should the nurse say? And then the nurse goes, so tell me about how you're feeling
Yeah.
sad and anxious. There, I just told you I was sad and
Yeah, or
anxious.
like, or
Right?
so you're feeling sad. It's like
Yeah.
that's
So
all we're
you're feeling sad, like
gonna
reiterating what they said. And it's like they don't want to hear it
Yeah.
all over again. They know they're
Yeah, yeah.
sad.
Totally,
So
totally.
I feel like that was so hard for me, because
Yeah.
taking the exams, I was like, well, I try to think of what I would actually do, and that's not what I would actually
Right.
say. So
Yeah.
it was a little frustrating, but
Yeah, it's
that's
just
kind of
different
how
than
it
how
is.
we actually
Mm-hmm.
talk.
Yeah,
Yeah, I feel like the
but
communication was the biggest part. I mean, you are gonna have like some kind of medical questions with
mhm. Like meds are pretty
with
big.
meds.
The meds
Yes,
were
that's
a
what I was
big
gonna
part.
say. But a lot of therapeutic communication, and then just kind of like interventions with like how to like interact or manage different mental illnesses. Like if they're
Mm-hmm.
bipolar, if they're in a manic stage,
Mm-hmm.
how are you gonna kind of like help them in that, or like redirect them, or help
Right.
them use their energy in a productive way, kind of
Mm-hmm.
thing. So it'll
Yeah,
be
and
like
all
that.
about the environment too.
Yeah.
You'll learn
Yep.
about
What
that.
environment they need to be in. Yep.
Mm-hmm.
So I feel
That's,
like,
I feel like that's
yeah,
kind of it for
yeah,
mental health. But
yeah. Really
if
just
you guys
about,
have any questions,
mm-hmm,
you guys can always just like if a specific question comes to mind, you guys can always reach out for
mm-hmm.
specific terms that you guys have questions for.
Yeah, really
Um,
just about learning to treat patients with dignity and respect in their
yes,
vulnerable moments.
absolutely,
Yeah.
always.
All right.
What's
Physical
next?
assessment.
Oh yeah, PA. Okay,
PA.
PA was really hard for me. I
It
don't
was
know
tough.
why. It was so tough, and a lot of
Mm-hmm.
it was memorization, to be honest.
Mm-hmm.
And it was also like the way the questions were asked, because I would perform my head to toe and I would nail it, and then I would take the test, and I think I remember at one point in the class I had a 62%, and you have to have a 76 to pass the class, and I was like, there is no way I did pass. So if you're in that state of like below the passing rate, you can do it. You can get yourself back
Yes.
up there.
Yes. Have faith.
Yes,
Mm-hmm.
the thank you Jesus, because I did not get let down, but I pushed myself to my limits. It was really challenging, very
Mm-hmm.
difficult. Um, but now I can do a head to toe assessment like no other.
You're
So
you're so good at it. You have
so
it dialed. You have it so
dialed,
dialed.
yes.
I mean, I feel like
It is the
just
most sorry, I was gonna say,
oh
it
no,
is
you're
the
good.
like one of the most important terms in nursing school. You are
Yeah.
gonna do assessments every single day of your life as a nurse. Either depending on what floor you work in, you either do it every 15 minutes, every hour,
Mm.
specific parts of the body. But I think one thing that I was really stressed out was learning, the Weber's sign and like being
Yeah.
like, do I have to do that every time I come
Right.
across a patient do like their hearing exam and everything? And no, the answer is no, you're not going to be doing that all the time as a nurse, but knowing kind of how to do like localized assessments
Right. And that's
is
the
the biggest
thing
thing.
about PA is it's kind of overwhelming because it's so detailed, like all
Hmm.
these different assessments you may ever do as a nurse, but you're not going to do it in like your daily head to
Right.
toe,
And
maybe.
you're vocalizing
Um,
everything.
yes, you're, and just like I mean, all the tests you're getting tested on, all the abnormals. It's not just running through your head to toe. It's like what could be abnormal, what is normal. So it's
Hmm.
just like it's very detailed. That was the class like we were talking about. We kind of got close in because we
Yeah,
were
we sat
partners.
next to each other and she prayed.
We prayed
Well, I
before
think you
exams.
prayed for every exam because I loved.
You jumped in there too.
Yeah, sometimes I did. But Taya's prayers are just like so powerful and good. She prayed before our interview today, and it was so
So
good.
sweet.
I almost started crying. I was like, I can't.
Mhm.
Every time she prays, I'm like, Ugh.
I was
But
happy I got to.
yeah, it was good.
So have a good partner because you're probably gonna have to like do a really detailed head to toe like
Hmm.
actual validation as well. So it's like you have the skills part of this class plus the testing. So it's a
True.
lot.
It
It's a
is
really
good.
detailed
Actually,
head
that's
to
a good
toe.
point to like pick a good partner that you
Hmm.
want to do that with because you don't want to pick someone that's like, oh, let's just get through this because it's not a class that you want to just try and get by.
Hmm.
This is one of the most important assessments is your head to toe, and you can really injure someone from not doing a thorough head to toe.
Yeah,
And
absolutely.
so, and going back to kind of like not going back, we didn't really talk about this, but kind of has to do with like mental health and like signs of abuse. Like those are very big
Mhm.
signs, and sometimes those get missed during a classic head to toe by a nurse. And where the sun don't shine, the behind the ears and underneath, the
Behind the
shirt.
ears.
What? Behind the ears.
I don't know what I was
Sometimes the
thinking
sun
when you
doesn't
said where
shine
the
there.
sun don't shine.
Well, I know what you were thinking when I said. Is that my alarm? What for? What does it say?
Nothing.
What time is it?
Um, 7:30.
No.
What?
Oh, it never goes off when I need it to. I was supposed to clock out yesterday. Why'd it go off today? Oh. Anyway.
That is so funny.
Thank you. Dang it. See, that's so awful. Okay. Oopsie.
Anyways,
Hopefully my teacher clocked me
that's
out.
funny. I
But
always get scared with the military timing with
same.
nursing school that when I have to set an alarm for like clocking out or something, that like I'm gonna set it
No,
for
I
the
do the
wrong
same thing.
one.
Oh,
Yeah.
pro tip, guys. Set your clocks on your phone to military
Yep.
time. That's the
Right
only way
now.
you're going to learn it.
Even if you're not in nursing school yet, do it. No, truly.
No, that's smart.
Even no, I'm saying if you're not in nursing school yet.
Oh, okay. I thought you said if you're not in nursing school, do it. I was like,
I mean,
why?
true, you can just be better than everyone else and have military timing on your phone.
That's true.
People will see it and they'll be like, "What is that?" I'm like, "It's military
I'm like, it's
timing."
military time. I
They're
don't
like,
know
"What?"
why they do it in nursing school, but they do.
And they're like,
Okay.
"You know how to read that?" I'm like, "Yeah, I do."
Why do they do that?
Probably so it doesn't get mixed up if you're like charting stuff. It's like, oh, 7. Like if you put like so things don't get mixed up if you like gave
7
something at
a.m.
7.
or 7 p.m. type thing?
Yeah. Yeah.
That makes sense, huh? What were
I'm
we talking
assuming.
about? Okay, we should get
Okay,
back.
we're really it's
We're
okay.
really going on a
Hopefully
tangent.
you guys enjoy the
My point is do a thorough head to toe assessment because you can never you might see some abuse going on
Mhm.
that you didn't do a thorough enough assessment and you couldn't even find that in the first place. So I'm not saying that to just be hard on you or anyone, but sometimes nurses are so busy they feel like they can't do a complete head to toe, and it's really important to make
Mhm.
sure you do a thorough one.
Yeah.
That's just what I'm saying.
And just like start learning now how to do it and how to do it right because like that's always
Yes.
one of my fears is like I don't want to like not
See,
I don't want to miss something,
I
like I don't
know.
want to not know what I'm doing when I'm listening to lung sounds, and that only
Yeah.
comes through practice, and you're not going to learn it all in PA. You're going to learn it at clinical when you are listening to things, but just really listen to those lung sounds when you're at clinical. Don't just say you listen to them because
Yes.
that's like my fear is like
They
what if I don't want to get on the floor and not know,
I know.
so
I know I've had my nurse say, "Okay, what do lung sounds sound like?" And I'm like, "You want to base this client's condition off of what I hear?" I was like, "That's
right,
terrifying."
yeah, like
I was like, "You
mention
should
something
listen to
that you
confirm
did.
it though." And
Yeah.
my instructor, my professor is always like, when I say, "Can you just listen just to make sure what I heard is really what I heard and it's true?" She was like, "Well, you're going to be the nurse, so we're going to go off what you say. What you heard is what you heard? And I was like, well, I don't know what I heard.
Yeah,
I was
I
like, I don't know.
know.
But the point of why I'm saying that is you
Yeah.
will actually know what you hear because in the beginning you're listening to all your classmates' lungs, which are for the most part clear, right?
Hopefully, yeah.
Hopefully, yeah. And then when you go into ICU, like what we're doing right now, we're
Mhm.
doing lung assessments I think they do like full body or um, once every 4 hours.
Mm.
Right, they do really like vitals every four
Yeah.
hours. It depends what
Yeah.
a condition your patient is.
But you hear a ton of abnormal lung sounds
Yes,
in the
and you'll know
ICU
when you
all
hear
day,
them.
yeah.
You really
Yeah, you do. So just like if you're like, I have no idea what's the difference between wheezing, crackles, bronchi, like once you start listening, it will don't be too hard on yourself because it'll
right.
start clicking, but
It'll
just
come.
start doing and trying so you
Yeah.
can
It's like when they say
yeah,
you'll learn it on the floor. You really do learn it on the
yeah,
floor. And I hate when people told me that. I
yeah.
was like, oh, I want to know it before I get there so it doesn't
Yeah.
stress I feel like it stresses me out. But
Mhm. Yeah, totally. And just the other thing with PA, I mean, we can't remember it all, but I know it seems silly to learn all of these super specific signs and tests and things, but just coming from people who are now later in the program, it will come up later. Like we just learned
mm-hmm.
about pancreatitis and how they may present with Colin's or Turner's sign. And the second our professor said that, I was like, I specifically remember learning that in PA.
Yep.
And I kind of had to remind myself, okay, which is which and
Mm-hmm.
what is this again and what does it mean? And so it will come up later and don't be hard on yourself to like, it's so much information. You're not going to remember it all. We're all human, but just there is purpose in what you're learning. Cause I know sometimes in nursing school it can be like what?
Yeah.
Like why?
When are we gonna need
So
this? Yep.
just, yeah, that just came up and I was like, okay, well, I remember this from PA.
Yeah.
So,
No, that's so true. You'll
hmm
use it again. You'll
hmm
use everything again. Um Huh.
yeah.
Gosh, I think that may be it for PA.
hmm Yeah.
But studying wise, do you have any tips for studying? I guess
mm
for me, it was just a lot of flashcards to be honest. It wasn't kind of where you had to talk through everything and critically
mhm.
think. More so,
Yeah.
it was more this is just what the signs and symptoms this is what is being presented by the patient and it's just kind of what you have what's in front of you.
Yeah,
So,
it's just yeah, a lot of information like I said, like you have to know your abnormals, how to do the different tests. So, read your textbook, look at the pictures in the textbook and yeah, it's kind of just about like understanding and sort of memorizing in a way.
yeah,
So,
that's true.
yeah.
Sorry, I'm like really me and Tay and I today are just we feel like we're on a different
Yeah,
planet.
we're in the final stretch of this term. We have
Yeah.
like 2 weeks left and so it's
So
just
if we
kind of
sound all over the
there's a
place like
lot.
we are, our brain is.
Mhm. Yeah, there's a lot going on.
Yeah.
Little sleep.
Oh yeah. Now I can talk about it.
Yeah, Kayla had an
I
interview today.
I did. I had an interview, and I am a very nervous person in interviews because when I get nervous, I talk a lot and I ramble. Um, but Taya always told me what her dad always told her,
Mhm.
and what I remember doing my other interview when I was
Yeah.
for that other CNA position, is that they know they're gonna hire you within like the first minute, 5 minutes of you talking,
Mhm.
even 30 seconds. Someone can
Yeah.
really tell your personality. It's kind of like when you meet someone out for, you're hanging out
Mhm.
with someone or you're going on a date with someone, you can relate to everyday life. You know within the first like 5 minutes if
Yeah.
you get along with
Kinda
that
like who they
person
are
or
as a
who they are.
person, yeah.
Yeah. So and they can see that and you can't fake, how do I say, like talking professionally. Like if you really don't naturally talk professionally, if that makes sense, like a professional vocabulary, like don't beat yourself up over it. I do
Mhm.
not have a professional vocabulary, and I was beating myself up for it for the longest time because my really good friend that I was doing it with, she was telling me everything that she was going to say, and I was like, you sound so proper. And the one thing that she told me was like, okay, well, this isn't how you talk though, so
Mm.
don't go into it trying to talk like this because you're eventually going to get you eventually will get nervous and you'll end up just kind of
Yeah.
resorting back to how you normally speak.
That's such a good point.
So just kind of like speak how you normally
Mhm.
would. Um and they already know if they're going to hire you or not. So
Yeah.
you don't have to the questions are kind of just questions that they ask not to prove anything to them, but more so just the protocol. And they
Mhm.
have to ask you those questions. Um but they also do want to get to know you too. So just we'll kind of I think have an episode I think on
Yeah, we
interviews and
definitely
kind of
should.
what to expect because I have gotten so many tips and good pointers for it.
Mm.
But when I went there, we went and toured the ED, and like I kind of said, there were so many patients, and we most of them were um, either came in for substance abuse or mental health issues. So it was a lot of psych, and
Mm.
I was like, oh, great, I can't be a psych nurse. Like, that's the one I told myself I wouldn't do.
Yeah.
And, but now I'm just kind of, I'm open to it. I'm like, you know what? This is just the population of where that, hospital is. And it's just what you're going to get in ED. You're going to see a lot of different people coming in. There were like kids there. There were so many different populations. So it went really nice, I think.
Yay!
So we'll just hope for the best. But if God closes that door, I know He'll open another one. So I'm that's kind of the most comforting thing I can think of when it comes to interviews and kind of feeling stuck in your when you're, I guess, not feel like you're not moving forward or no place is accepting you. Like, um, there's purpose in that. And I wish Caden was here to kind of talk about that.
Oh,
If we have an episode, maybe we should have him chime in for that. But Taya's
that'd be good.
boyfriend had a long period, a waiting
Mhm.
season of about a year, I think it was,
Yeah.
of just waiting to get into to get hired by a station. So
Yeah, he did a lot of interviews and a lot of doors were closed. So
yeah, and
it was
that's
hard.
really discouraging when you've worked so hard to get where you are, and when it's so hard when you see someone like that too, because you're like, gosh, like we need more, firemen like him.
Yeah.
We need more nurses like my other friend who's having a hard time. I'm like when I see her, I'm like, how do you not have a job? Like
I
you are
know.
like, I know, like a light on this earth. Like I was like, we need more nurses to be like them. So it's hard when doors are closed, but
Yeah, it's frustrating because like
you can see.
they only see such a small part of you in the interview, but like
Yeah.
everyone in your life is like
Yeah.
sees this amazing
Right.
person you are, and it's like if they could only just
I
see,
know.
if I could just call them and tell them how amazing they are, they would
Right.
know.
No, that's true, and that's kind of how I felt in my
Yeah.
interview. I was like, oh gosh, like I felt like
Mhm.
I wasn't able to explain my full self completely. I was so nervous.
Mhm.
So do a lot of practice
Yeah.
runs.
Yeah.
I kind of went in. I was like, God's got me. I'm fine.
Yeah,
And I was
he
like, I actually
does.
should. He does. He does have you, but you should practice a little bit.
Yeah. Yeah. And Caden has a job now, so it comes through. Okay, I'll probably just have to do the prayer.
Yeah.
In a separate
Sorry,
one.
we're running out of time. But
yeah.
we'll go into the prayer.
Definitely.
Taya
Yeah.
will say it.
Oh, okay.
Sorry, can you say it?
Yeah, I'll do a super duper quick one.
Okay.
Dear Jesus, thank you just so much for this day, just for always being with us and having a plan for our lives. I just pray over everyone listening to this that you would give them strength and guidance throughout their week, and just that they would lean on you for everything they need this week. You are all we need, and we just love you so much and thank you for that. And we lift up Kayla's interview to you as well. And in Jesus' name we pray. Amen.
Amen.
All
Have a
right,
good week, guys.
We'll be back.
Yes.
Later.
See you later. See you in 2 weeks.